Hello everyone. I want to tell you today, nausea and vomiting caused by chemotherapy. How does traditional Chinese medicine prevent, treat and solve these problems? The most common method of treating cancer is chemotherapy. But chemotherapy can cause many side effects. Some patients develop symptoms after chemotherapy. The most common side effects are nausea and vomiting. These side effects during chemotherapy for cancer patients. Most common gastrointestinal side effects. Severe nausea and vomiting will affect the smooth progress of chemotherapy. It can cause electrolyte imbalance. Seriously affects the patient's nutrition and quality of life. Some patients may even become intolerable. These unbearable vomiting and refuse to continue treatment. I want to introduce little-known treatment methods of traditional Chinese medicine. First, there is no need to drink bitter tea, and no need for acupuncture. And the effect is very ideal. Traditional Chinese medicine believes that cancer patients receive chemotherapy. Chemotherapy drugs enter the body. Its poisonous evil stimulates the organs, qi and blood throughout the body. Produced varying degrees of reactions. The spleen and stomach are especially affected. When the spleen and stomach are not good, stomach gas is reversed, causing vomiting. Traditional Chinese medicine prevents the effects of chemotherapy, toxicity and side effects of chemotherapy. Its own uniqueness. First, you can take Chinese medicine orally. Second, you can do ear acupressure. Third, methods such as Acupoint application of traditional Chinese medicine. Let me tell you something first, how to use Chinese herbal medicine to solve the problem of nausea and vomiting, if vomiting occurs. Poor appetite. The mouth is also very sticky. Those tongue coatings will also be very thick and greasy. Traditional Chinese medicine believes that these symptoms are spleen and stomach misfortune. Water vapor does not melt, caused by internal growth of evil dampness. How to treat it? Traditional Chinese medicine uses aroma to dissolve dampness, transforming qi, drying dampness and diluting water to infiltrate dampness. Methods to reduce qi and stop vomiting. Is there any way? We have an ancient recipe. It's called Huopuxialingtang soup. Treats nausea and vomiting caused by chemotherapy. What medicine does Huopuxialingtang decoction contain? There is patchouli, Magnolia officinalis, Pinellia ternata, poria, raw barley, white kernel, polyporus, tangerine peel, zhiru, talc, ginger. These herbal. How to do it? Very simple, like how we make herbal tea. Appropriate amount of water, soak for about half an hour. It will be okay after boiling for about half an hour. Just drink one every day. The herbal medicine can be reboiled and drunk one more time. Drink the second time about 4 hours apart. It will be better. Second method. What I just said, there are many methods of TCM treatment, auricular pressure. We used auricular acupressure. Take out the acupuncture points first. One called subcortical, pillow, Shinto gate, stomach, diaphragm, liver, courage. How to place these acupuncture points? I'll show it on the ear model later. To teach you how to find acupuncture points. Subcortical point, what does it do? This acupoint is mainly used to regulate the excitability of the cerebral cortex. Improve gastrointestinal function. The other one is pillow and Shenman acupoints. Has a sedative effect on vomiting. Acupoints on the stomach and diaphragm, with moderate focus. Strengthen the spleen and stomach and regulate qi. Inhibitory effect. Liver and gallbladder acupuncture points. Soothes the liver and promotes gallbladder. The function of strengthening the spleen and stomach and regulating qi. By stimulating these acupoints, conditioned are functions of organs and play a therapeutic role. How to operate it? Apply to acupoints before using chemotherapy drugs. Disinfect the ears with 75% alcohol before applying them. Then determine the acupuncture points. Stick it on the corresponding acupuncture point. We press each acupuncture point approximately 50-100 times. Press 3-5 times a day. Let's use one ear first. Change every 2 days. Avoid skin allergies at acupoints. Then stick it on the ears. Until the end of chemotherapy. What should we pay attention to? As I just said, we need to do a good job of disinfection, aseptic operation, prevent local infection. The pressing force should also be moderate. Some people have more sensitive skin. Press. When you feel pain when you touch on it, there may even be hot and red. Let's not continue the intense stimulation. Or stop it. Acupoints not to be applied. People sweat more in summer. We can reduce the time and the compressions. Avoid infection. At the same time, it also prevents the material we just pressed. Don't let it fall into your ears. This is very important. How can auricular points play a therapeutic role in us? According to our theory of traditional Chinese medicine, adjust our qi and blood to dredge the meridians. Achieve the purpose of treatment. This is the model of the ear point. This is an ear pressure material. Show me how to stick it on the ear. This ear is just like what I said just now. One of the acupuncture points is called Shinto gate. Just go to this position. Just use one material for this. Let's tear it out first. We see it as a bead. This bead is the Shenmen point. Facing it. Stick it. Press with finger. We need press it 50-100 times. The intensity should be moderate. 1, 2, 3, 4, 5. Just press it like this. This intensity is okay. This is a method of auricular point treatment. There is also a third method. It's just acupoint application. We mainly choose 2 acupuncture points. One is Nidwen point. One is Shenk point. How to get the Nidwen point? We have a horizontal stripe. First horizontal stripe, 3 fingers. After the middle of this line, there are 2 ribs here. Between 2 ribs, let's make a cross here. This is the Nidwen point. Shenk point is very simple, right in our belly button. Half an hour before chemotherapy. Stick it on the 2 acupuncture points we just selected. One is Nidwen point. There is also a Shenk point. If we stick it in the middle of the belly button, it will be okay. Where is the material? Let's keep it simple. 2 Chinese medicines are basically enough. One is Pinellia ternata. One is ginger. How to operate it? Let's first put that Pinellia ternata, make it into powder. Crush the ginger or use a juicer. Then squeeze out the juice. Mix Pinellia and ginger juice into puree. It's okay if it's sticky. Fill it with Xiang's He sticker. Let's stick it up. Xiang's He sticker is an adhesive tape. Just press it and stick it and it's okay. Change once a day. Until the end of chemotherapy. Let's talk about the role of materials. Our ginger has a mild nature. When Yang Jian stopped vomiting, the effect of Pinellia ternata is dry dampness and resolve phlegm. Eliminate pimples and dissipate knots. Reduce qi and stop vomiting. When these 2 work together, 1. Very good at stopping nausea, anti-nausea effect. What we just said, we choose Shenk point. The skin here is thin. There are also many under the navel. Network of veins. There are arterial branches in the abdomen. The barrier is relatively weak and permeable. Drugs penetrate easily. Once it penetrates, it is easily absorbed. This is a very good route of administration. Since it is easily absorbed, it is easy to achieve the medicinal effect. The other one is Nidwen point. Many people know about Nidwen point. When nausea and vomiting occurred, people just massage these acupuncture points with their hands. All have a soothing effect. We are using the herbal to stimulate it. it play a better role. Because it lasts. Stick those medicines here. What are the benefits of using this Acupoint application? First, some people are afraid of drinking Chinese herbal medicine. Second, some doctors tell you that during chemotherapy, don't take Chinese medicine. Of course, the patient should be cooperate with the doctor. We can simply do a complete set of Western medical treatments. Sometimes those Western medicine antiemetics may not better than traditional Chinese medical method. So, this method is so good, no need to take Chinese bitter herbal medicine, no need for acupuncture. It also has a very good effect. This treatment method is worth to try. We also need to pay attention. Some people have particularly sensitive skin. If you apply it, your skin will become red and itchy. Let's not go ahead and do it. Including ear attachments. Especially in the summer when you stick it. If there are some sweat, the skin will soon become itchy and itchy. We must handle this carefully. Avoid skin allergies. This video, just for your reference, if you really want to use it. How to treat. Of course, you have to consult a doctor. Then you can get the best result. I hope this episode can help the royal family. Goodbye, see you next time.